Hi, this is Dr. Habib. Today I'm with Joel and we're going to discuss a few things about how he's feeling, but more in terms of in the direction of inflammation. So, Joel, we spoke earlier on today and you gave me a few symptoms. Just tell me what are the main symptoms that you're dealing with.
So a lot of symptoms, but the most painful one to me is pretty much constant muscle soreness. I want to call them strains, chronic pain throughout my entire body. But I'll tend to have day by day or even week by week, I'll tend to have specific areas that are much more inflamed than others.
Yeah.
Some of my spots are in the traps area. I have a bad shoulder pain. That may have been partially due to an injury. I have noticed that my injuries just don't heal. Like they don't heal. Like I had hyperextended my elbow a year and a half ago, and I'm still getting muscle pains.
I'm just going to remind you, so that speaks volumes.
Correct.
Young person, injury, not healing, and then you mentioned about muscle soreness, which you thought was to do with exercise or the recovery.
I didn't think that because I've worked out my whole life, and I was always a very good recoverer.
Yeah.
Very good at recovering, very good. And I noticed a switch was flipped. At one point, I got a little better, and then once it was flipped again, I could tell something was wrong. Within a month or two, something was wrong.
Yeah.
When I'd work out, I'll twist the wrong way, and I'll get pain in the back for like a day.
Yeah.
Like things can mitigate it, ice,
Sure.
massages, acupuncture,
Good.
like foam rolling, things like that. Working out is like a mixed bag. Like it makes me feel better and looser in the blood flow and all that stuff, but it also can cause those strains and sores and stuff like that. It's a total catch-22 on that.
When did it all begin? I mean, was there a time where things just were very noticeable?
Yeah, so I think thinking back after doing some research back and forth with other doctors, other nutritionists, etc., I didn't really notice real problems until I was about 20. I'm 31 now, so I was about 25 or 26. And I had been doing a lot of CrossFit and working out. I was coached CrossFit. I was doing a lot of heavy working out. I recovered great all the time. I was very fit. And then I just stopped being able to recover. It almost felt like it was overnight. Oh, not quite overnight, but within a month or two, something just changed. Yeah. And I started I've always kind of had like certain things like constant pains in necks and stuff like that, but they were minor and I could get past them. The rest of my body was great. And then it felt like this was kind of my whole body.
Got it. So basically you probably noticed it in your mid-20s.
Yeah.
And it was milder, you'd recover better, and over time it just seemed to be more persistent. And I think somewhere along the way you mentioned that maybe the bowels were, or the gut may have not been so good.
So when I started to have the really bad muscular issues, kind of somewhat, I didn't fully pinpoint it. I was about 25 or 26, and then I didn't correlate the two, but the gut issues started happening. It was diarrhea, like leaky gut for sure. Like I eat and then I have to go to the bathroom, or if I take some supplements or some Asian herbs or whatever, it's out of me in 20 minutes, 30 minutes later, liquid. And then that kind of got better. Once I fixed that, I actually started to feel a little better for a little while, for about 6 months. And then about 27, that's when it just, from then till now, it's been pretty much constant and got worse and worse.
So basically, as the science is today, the microbes in the gut process what you put in. Based on that, it signals to things like the liver, and then the liver sends inflammatory cells. So what you're describing sounds like inflammation. And the basic symptoms of inflammation at the mildest level can be stiffness, and then aches, pains. And then in later, more severe cases, the signs of inflammation might be tenderness and swelling. Yeah. And so they're not limited to just the muscles or the tendons or the ligaments. It can be more serious. For some people, particularly with autoimmune dysregulation, what that means is that the immune system sends antibodies out and they deposit on the joint lining like a knee joint or a shoulder joint. We call that synovitis because there's a synovial membrane around that joint, and if there's inflammation on the membrane, it's called an itis, synovitis, and that's an inflammatory type of arthritis. So as I described, there's different levels of inflammation. Some of those are measurable, some of them are less measurable, and some severe ones are highly measurable, to the point where people go on steroids or immunosuppressants because they're very serious. The milder ones are basically where it's related to food, and some people call it food inflammation.
Correct.
And there's testing for that. I know we're going to review some of those things.
I did do that recently with Dr.
Yeah,
Habib.
so we'll review that, and there are different techniques out there. There are techniques where they just measure antibodies. There are techniques where they measure antibodies with complement. Complement is a much more specific way to tell you that the immune system is active and actively against something. So if it's an invading parasite or bacteria, great. But if it's against your food, then that's not so great, because that complement means the immune system is out to attack. And if those things are in your body, it's going to attack your body. And it can happen from anywhere from head to toe. So some people may have headaches. Other people may have problems with their upper airways, sure. Respiratory, joints, skin, abdomen. And so it can be a global thing. And generally when you go to a regular doctor and you complain about these symptoms and they do basic tests, they don't find anything, they say, hey, everything's normal. Yeah. But that's not what it is. And I think I alluded to that you may look fine on the outside, but you feel differently on the inside. Now, so in summary, I'm going to just say that you described symptoms of inflammation, you described a lot of musculoskeletal stuff, you described how it happened many years ago, but now it's more persistent, a little bit more severe, and slower to recover, and probably interfering with your day-to-day quality of life.
Other symptoms have started to come up with it, and those have gotten more and more severe.
And we're going to elaborate on that. And then how the gut may have been a factor, because that was, breached a little bit, recovered, and so forth. And then I wanted to now, let's go with what you're saying. Well, what's the other things that you described?
Okay, so joints would be a secondary one.
Yeah.
It's not as bad as the muscles. I've always kind of had a little bit of inflammation in my joints, cracking, a lot of cracking, and knees are always a little swollen, tendonitis, stuff like that.
Sure.
That doesn't bother me as much. I could live with that if I had to. Sleep issues.
Mm-hmm.
I don't sleep as well. Even when I do sleep, I don't feel quite as rested sometimes.
Great. That's exactly where I was going to go.
Yeah.
So joints is just a variation of ligaments, tendons, muscles.
Yep.
As I said, those antibodies head to toe. Yeah, everyone's different. It's going to present differently. So sleep is very important. So at what point was it a choice, and then is it no longer a choice? Meaning you can choose when to sleep and when to wake up. You chose not to go to sleep maybe, and what point are you at a point where it's difficult to sleep now?
So my problem has always been, I can usually always fall asleep. My problem is I wake up after 5 hours or 6 hours, and I'm not rested at all, and try to go back to sleep and can't, at least for a while. Luckily, I have a fairly flexible schedule, so I could be up for a couple hours and go back to sleep for a little bit, or maybe take a nap later, but it's tough. And if I don't get that 8+ hours, granted, I've always been an 8-hour guy, but I could be fine on 7, and but now it's if I don't get 8.5.
So were you the type that just got by on less sleep when you were younger?
No, I was saying I was always an 8-hour guy, but so I could get by on a little bit less.
Yeah.
But what I'm saying is now I absolutely need it, or it's or I'm screwed for the day.
Got it.
It's bad.
Yeah. And so frankly, do you feel that your sleep is disrupted, or is that when you wake up you don't feel rested from the beginning and still now? Okay.
Both.
Now, so let me give you the connection there. So sleep is not only a period when your body recovers, just from rest point of view. It's really a time where your body heals itself. Yeah. And so the direct insult is on the gut. In other words, temporarily more acid may damage your gut lining. Your intestinal lining, which is actually a very active organ, the secretory lining is where peptides are released, and those are messengers for the body. And so what people don't understand is that the immune system is the intestinal lining. A lot of people describe the lymphatic system that's connected to the gut as the immune system, and they're correct. But the lining and the lymphatic system that's on the outer connections of the intestine, they're one and the same. But the lining is what gets affected by sleep disruption. So what I was alluding to is that young people kind of choose to kind of go to sleep late, wake up early. They may not feel anything at the beginning. And what it does to the gut, it starts to breach it. Breach means make it weak. On top of that, add poor dietary choices. Sure. Add to that an infection here and there that don't seem related. What I'm getting at is now a perfect storm where the immune system is now raging. Yeah. So when we talk about inflammation, it's about balance, right? So you have some inflammation, it's normal. Anytime you burn your carbs, you have oxidation. Oxidation means there's some inflammation. When you exercise, you're going to get heat. When you exercise, you're going to get some inflammation. What I'm getting at is that too much exercise may create too much inflammation, right? And and then conversely, if your immune system is strong, it'll bring it to a balance, right? So you exercise a lot, no problem. Make sure you rest enough. Yep. You exercise a lot, make sure you put enough antioxidant to your body. And so if we're looking at inflammation and you're not sleeping enough, then maybe the inflammation is higher. If you have something in your body that's creating extra inflammation, it's higher. So what we're trying to do is get to that balance. In order to get to that balance, temporarily, we may have to raise your immune system so you can balance out, and then slowly work through the different systems, layer by layer by layer. So, I tend to start on the things that affect you most on a day-to-day basis, because we're human. We need to feel better. Correct. To then function better, to feel motivated to go to the next step. Yep. It's not a quick fix, a wand. It's a systematic approach to it. Because by the time people have symptoms, so even in your mid-20s, I propose that the things may have been breached earlier, but little Correct. At a time. And even at the early stages, it was little, and now it's getting to the stage where it's better. And so the aim would be that to understand that inflammation and oxidation don't just come from anywhere. There are multiple systems involved. Yeah. So the diet and the gut is one of the biggest one. The communication with the liver is a very powerful one. How the brain connects the gut and the liver. It's like a triad. Now, people describe many other combinations. They're all important, but that's kind of the center. And from it, hormones are affected, yep. Right? So I have athletes with deranged hormones, because that extreme athleticism has a price to pay. So if you don't understand how athletics can be damaging to the brain or damaging to the gut, that's a problem.
I think that played a part with me. I was working out pretty hard. Yeah, I never tested like crazy low, but on low into normal for like testosterones and stuff, like in like the 500 range. Yeah. I was able to up it at some point with doing all those supplements and herbs and like stuff like that. Yep. To like 650.
So one of the things to understand is that and this is a mistake I kind of made myself, was that as I'm working out hard, I didn't realize that my need for glutamine was going to be so much higher. Without it, it was putting a tremendous stress on the gut. So I'm thinking, I don't have any problems with my gut. I feel fine. My bowels are good. But it's the unseen. So here we started by saying, you look fine, but you don't feel fine. And the way you describe things, we can go through an algorithm and figure out, okay, what are the layers that's going on? And then what we would want to do is have some objective marker for each and every system and put an algorithm together. Sure. And from that, you say, okay, there's a plan of action now. Which one do we address first? Yeah. Do we address the inflammation first so you feel better today? Or do we say, you know what, I see an overwhelming gut symptomology, so let me fortify, heal the gut first? Or do I work on the liver that's sending out the signal? See, it's a kind of a moving target, and our job is to kind of share the information and find a balance between, getting to the root in a natural way to deal with immediate symptoms, and then, as I said, getting to the root, which inevitably, as you've already endeavored in the path of changing the diet, getting better quality sleep, taking certain things to support you, but instead of guessing, you measure the antioxidants, you'll measure the amino acids. It's all about measurement, right? And then what we kind of don't understand is that even though you're young, you may have genetics, Correct. Which are fine, they're not going to change, but you may have genetic weaknesses that may explain a little bit more of why the breaches came out sooner, because you're kind of young, so it shouldn't have come out now. So it would be a good idea. And what I say is that there's no negative in a bad situation. Let me explain. If you hadn't got these symptoms, you'd continue for another decade the way you've always done. The fact that you have a theoretical crisis, you're addressing it. By looking into it, you may discover things that you wouldn't have looked into had you felt fine.
It'd be easier to fix.
So you may actually prevent something bigger coming down the road.
That is an extremely glass half full look, but I like it.
Oh, it has to be that way.
I like it though.
Yeah, it has to be that way. I can tell you from experience that from my own life, I'll give you an analogy. My accountant said, I told my accountant, well, why is it so hard to take my fitness, nutrition, and medical center to the next level? Well, he said, look, if it was easy, then you would have got results and it wouldn't have challenged you to think in a certain way. Because you were challenged, you had to overcome that challenge, and from overcoming it, you created something even better. So that is a similar analogy. Adversity is just an opportunity. That's in the business world, that's also in the medical world.
True.
Yeah, so that's a lot of analogies there. And I thought of another one which was a little bit prophetic. And you may follow. What it is that in religion, what it says is that it's better to speak kindly than to damage with harsh words and then to heal. So what I'm trying to say is that it's not a good idea to break it then try to fix it. Try not to break it at all. It's like the statement under my wall, which says, the Chinese proverb reads, a good doctor diagnoses, a very good doctor treats, but the best doctor prevents it. So even though you may have certain things that are breach, but you're not diabetic, you don't have cancer, you don't have autoimmune diseases yet, so maybe you can prevent something much worse coming down. So that's what I mean by the analogy between business, religion, and medicine. I think medicine and the human body is an amazing organ, and so it doesn't surprise me that from my analogies of the human body, I'm actually seeing correlation with how the world revolves, because it's one of the same thing.
We're part of the ecosystem. Research and stuff over, like I said, I was biohacking and whatnot. But the cool thing I found, and again, I know this stuff is a base level, only reading other people's work, but like a lot of that preventative stuff can actually be somewhat performance enhancing on a day-to-day basis, which is kind of cool. Because it ups your level of how you are.
Exactly.
So you're upping where
so
you're at now.
We'll kind of go in this direction. Inflammation would be okay if we said, well, I can handle a little bit of aches and pains, I'll take a Motrin. But inflammation stops the detox system working well.
Yep.
Inflammation damages your DNA. Yep. Inflammation will compromise every single system in the body. Yep. In fact, inflammation is the gateway, the window, the door to other things happening. So if you can identify in a complete way as possible inflammation and shut it down, you can actually prevent heart attacks, dementia, and all sorts of immune disease.
I wish I'd known all of this stuff when I was like 5 years ago when this first started happening. I would have really tried to fix it sooner. I kind of put up with it.
But the good news is that you're still relatively young. Yeah. And so what happens is that, aging, oxidation, inflammation. Sure. So there's ways of measuring your DNA age by the DNA has telomeres at the end of it, and oxidation or inflammation will make you prematurely age. So that's the beauty of what we're talking about. Let's measure these things, and instead of saying the glass is half full, it's like, oh, okay, now I can see what's happening. So instead of addressing it 10 years from now, I've got the luxury of working on it right now. And so someone like me who's a little bit older will be saying the same thing, is that, the extra work and stresses damage my DNA. Okay, then I can just stay there, or can I reverse some of that damage? And the answer is yes, because the body's always ready to regenerate and repair. That biohacking, what it means is alter the signals, change the messages, and all comes from the gastrointestinal lining. The little thing that people just overlook, because if you don't have reflux, you're good. And leaky gut is still one of those things which most medical doctors are not really in tune with.
I know.
And but just to talk about that because it is science now, and that by the time you have leaky gut, you've already damaged the lining, which is where all the important messages are. So the gut is made of very tight junctions. If there's inflammation or damage, as the word says, leaky means the tight junctions are no longer tight. They're going to allow toxins and other materials, antibodies and abnormal fragments of protein to enter. And so when those junctions, which are made of sort of cells, they're connected with something called zonulin. And if you break that, then the zonulin gets released in the stool and the blood test. So instead of guessing and say, I think I have leaky gut. Why? Because of my stools. Because of my stomach. You can actually measure the zonulin, and you can actually diagnose what we call leaky gut. It's increased gut permeability. However, even when the zonulin level is not elevated, you can still have milder levels. At this moment, whether I have zonulin or not, I have some degree of leaky gut. Sure. It's just like saying everybody has some degree of inflammation, everybody has some degree of oxidation, everybody has some degree of leaky gut. Is it bad enough to leak the zonulin, but sometimes you don't have to wait till it's bad enough to leak. It's like saying, let me wait until the blockage in my heart is over 90%, then I'll address it. So that's the predictive power that as a clinician, we want to find that out from listening, by our experience, and then we use the tests to confirm or give you a much more objective algorithm. So we covered a lot of ground. So in summary, I'll say that it's the musculoskeletal system that's affecting you. Yeah. It's coming from inflammation on the inside. And we know that the gut is connected to the liver, but don't forget the brain. So the brain is not like sending a message for no reason. You can damage it with chronic stress.
And that's where I was going to get to.
You can damage.
Most recent symptom, I used to have the best memory ever. My memory has gone to crap. Plus fatigue. I can mitigate that, but the memory, I used to never write anything down, know my whole stuff for the day. I'd always remember everything. Boom, boom, boom. I'm forgetting stuff like it's...
Well, the good news is that...
That's the most recent one that's gotten worse in the last 6 months to a year.
And like everything else, with evidence-based and conventional medicine, they catch up later on. So now that we've diagnosed leaky gut, we're going to diagnose leaky brain. And leaky brain then allows inflammation in the brain. So I can only extrapolate. That means that I can't tell you as a physician what you have now. But I can tell you that in Alzheimer's, the prerequisite is inflammation. Yeah. And inflammation wouldn't be happening until there was a breach in the blood-brain barrier. So even though there's no confirmatory test, it doesn't matter. There's a breach in the blood-brain barrier. There is inflammation in the brain before Alzheimer's presents. And so just as an analogy, when you have a traumatic brain injury, and particularly those that have a little bit of a sequelae, right? My memory, my focus, took them a while to recover, or months or years to recover. Sure. There's a disproportionate number of dementia related to those injuries. Yeah, yeah. And then with football players, that there's CTE, that we know that's chronic traumatic encephalopathy, and they do well for a period of time, and then they fall off the cliff. So in other words, we can't directly extrapolate Alzheimer's and inflammation, but clearly trauma can start the cascade, which we call an inflammatory cascade. And that's how the immune system works, whether it's directly in the brain or really what's going on inside the gut, and then the messages that come through the liver, and then the immune system that's been given messages. So in summary, we'll say biohacking is just a fancy word for saying, well, what's the body saying? Yeah. And when it's not positive, how can we rewire it? Sure. So I have like 4 systems. What I tell people is you first reset, kind of like the old TV that's not working right. You just pull the plug out and put it back in, and the body works like that. Sometimes you reset it. You can reset it by intermittent fasting. You can reset it by stressing the body. We'll have to figure that out.
I used to do that for a while.
Yeah, and then you want to prime it. Put in the right ingredients, whether it's nutrients, amino acids, antioxidants, essential fatty acids. Make sure your hormones are balanced. So you prime it by setting the environment. Then you sort of stimulate regeneration. You do that through first turning off the bad signals. And then you've got this perfect environment where the body can now repair itself. That's at the joint level, that's at the muscle level, that's at the gut level, that's at the brain level. So the technique that we would employ is a global technique, and that results in global health. So you don't micromanage one part of the body. We go by systems with a focus, but the long term is global health.
Let me ask you a question, just out of curiosity. It's interesting to me that the brain stuff maybe came last for me. Is that if say you do have like a gut issue, let's say that's what has caused all of my stuff. Right. Let's assume. Does that make sense that the brain kind of came last? Is that the last last thing to get hit by the inflammation?
Yeah. So you'd understand that. Just imagine all the contact sports and the trauma. The brain is amazing to just hold up, right? And so the blood-brain barrier was designed to be a barrier. Yeah. Because it didn't want to be affected like the rest of the body. Yeah. Even things like glucose, which is good for you, and fructose and nutrients, but it's very well controlled. Yeah. And so it's the last one to get breached theoretically, which I agree with you, and it's the hardest one to recover. Great. But in order to recover it, you've got to go back down the path of where it started from, right? So I have another analogy, just to see if you can follow me. So with conventional medicine, we wait until the diagnosis of diabetes, heart attack, stroke, and cancer, right? Yeah. And then with people like athletes or young people, where, like yourself, you're going in another path where things are not functioning right. And if you wait long enough, you become kind of like diseased. And what doctors think is that, you know what, I'm just going to go from the diabetes, the cancer, and I'm going to make them like normal people again. And what I say is that you got to go back down the disease path right to the beginning, and then you go back to the normal path, right? So it's, a lot of people make the mistake of saying, I'm just going to go from pathology to normal overnight. It's like a path. It's windy, and you're trying to make it a straight path. And in order to heal yourself, you can't just jump from one path to the next. You got to go down that same path, find a commonality where it's a good place to start, and then you build yourself back up.
So theoretically, if you had diabetes, you would go back down towards pre-diabetes first, and you'd start having less symptoms, but still have show some of that stuff, and then you go down to.
And now we have proof that we can stimulate beta cell regeneration.
Sure. Okay, makes sense.
So it's like it's another version of stem cell regeneration. You have to send the right signals, but you don't want to just, you could try to do that at the beginning, but you won't get the same results until you kind of go back down that path. That's why I hope that analogy makes sense.
It does, and I think I've kind of realized with everything that I've done, and I have tried a lot of things, I haven't tried enough, but what I think I've realized is I haven't gotten my body into that little circle that you want, and so those things aren't quite working. Like, they show some results, but then they come right back to where they were. And I think, like I said, like working out, for instance, it's a catch-22. It makes me feel better, but it also makes me feel worse. And I think that maybe I need to also prevent inflammation at all the points that I can in my life, so that it most likely to be able to heal.
So what can you expect? You can expect when you reduce inflammation to feel better. You can recover faster, and your performance will increase, because without inflammation, you can release nitric oxide more readily. Nitric oxide will give you more blood flow.
What I meant was, obviously I get that. What I meant was, I have been still, even though I've been trying to fix my gut issues, for instance, I was doing certain programs or whatever you're gonna call them, I was still working out kind of hard and still introducing the inflammation while I'm trying to heal, and that's what I'm maybe. I might have to suck it up and stop.
I'll give you because I do it myself and I've lived it myself. I would be able to guide you as to what level of activity is still good for you, and because some of that it still stimulates nitric oxide release.
Positive.
It's positive, exactly. We just have to find that balance between too much, and then supporting that side of things. Great, so good.